Hello, everyone. Since I've got this opportunity to do my graduation and post-graduation from three different colleges, so I'll tell you about my personal experience of these three colleges. So I did my undergraduation from KGMU, post-graduation from Maulana Azad Medical College, and now DM Cardiology from AIIMS New Delhi. So whatever what are good in these colleges, I'll tell you about them and what are the drawbacks of doing your graduation or post-graduation from there. That also we'll discuss about. First of all, I'll tell about the KGMU. I've done my undergraduation from there, so it is very close to my heart. So first of all, we'll discuss about the positive aspects and the negative aspects. So academics is really, really good in KGMU. We used to have our evening wards, like in second, third, or pre-final, final professional. We used to go to the wards in evening. SR used to take our classes. We used to take a case, and in morning, the consultant used to discuss that case. So the academics were really good, and it's not like कि morning में class would be taken by JR or SR. Morning में consultants ही आपके ward postings में classes लेते थे. Infrastructure is really good. Campus is huge and a lot of buildings are new. So there is no issue that the college is old, so infrastructure would be not that good. It's not like that. And the culture is really good. Like we used to have our medico mother and father or medico parents. So these are our seniors who used to help us throughout our journey. And also the co-curricular activities are really great. Like in first year, we used to get our freshers. Then in second year, we used to give freshers. And as well as we used to organize this event that is Basant Panchami, in which we used to have a great Saraswati Puja for the whole day. Then in third year, we used to organize the sports month. So for the whole month, there's a sports competition going on, and the third year are the ones who organize that. And in fourth year, we used to organize our annual fest, that is Rhapsody. And then post that, we used to get our farewell. So there is a great culture. Also, internship is somewhat light, then that means you got this opportunity to prepare for your PG as well. Now, coming on to the drawbacks. So first is toxicity. So it is well known that UP colleges में toxicity होती है, and KGMU is well known for it. So as I have seen my seniors or the postgraduate students at that point of time, so there was a lot of toxicity, and especially the junior ones have to work a lot. Not only work, they used to face a lot of harsh words from the seniors. There's a lot of restrictions in KGMU, so it's not like in Delhi colleges ki you can wear jeans. You have to be in formal pants, formal shirts, formal shoes, and apron at every point of time. There's a lot of restrictions. You can't sit if a senior is around. You can't sit if a resident is around. There's a lot of toxicity. Even similarly, coming to the residency part, you can't sit if the senior resident is around if you are a junior resident. Another thing is bond. So when I was a UG, there was no bond, but from 2017 onwards, there's a bond if you do UG or PG from KGMU. So that is also a drawback. Salary used to be a drawback because there was a time when salary of KGMU and Delhi colleges differ a lot. Now there is a difference of 4 to 5,000 per month. So salary is not a issue as of now. Okay. Now coming on to the second college, that is MAMC, from where I did my post graduation. So for MAMC, the exposure is really good. The amount of patients are enormous. It's the biggest government medical college in Delhi. So you have to see a lot of poor patient, but the number of patients are really good, and the rarity of diseases are also there. So the exposure wise, it's really good. There is less restrictions on the way you have to wear your dress, and also there is really less toxicity. There's no bond at all, and the salary is really good. The drawbacks of MAMC that I've felt is, one thing is the infrastructure is old and there are no new buildings coming up. The campus is small, it's not that a huge campus, and academics are also not up to the mark for PG also and for UG also, with what I've seen. Like for undergraduate, they used to come to the wards, and mostly the residents are the one who teaches them. Consultants rarely ही ward में clinical classes लेते हैं, so that is the drawback of MEMC. Now, coming on to the AIIMS. So AIIMS, as we all know, is the premier institute. So उसका drawback निकालना is somewhat जो मेरे को नहीं निकालना चाहिए, बट देर आर 2-3 ड्रॉबैक्स दैट आई फील. So first of all, coming on to the good part, first is the infrastructure is really good, restrictions are less, and toxicity is really less. Exposure is good, especially to rare disease, because rare diseases का treatment और कहीं नहीं होता. So the rare diseases के सारे patient come to the AIIMS. The campus is huge, hostels are really good, and there is no bond with good salary. And academics are really excellent. We used to have a class every day from 8 to 9, even in our super specialty. And MD medicine, MPGs also, they used to have their classes regularly. Now, the drawback which I really feel in AIIMS is there's a huge workload, and a mental pressure is really there, because most of the time you have to treat patients and you have to maintain the decorum that the patient is getting treated from AIIMS. So you always feel this pressure कि ये तो एम्स है, you can't do this. और you always feel this pressure कि ये तो एम्स है, अगर यहाँ से पेशेंट को सही डायग्नोसिस या ट्रीटमेंट नहीं मिलेगा तो कहाँ मिलेगा. So there is a lot of mental pressure and a lot of workload, but overall it's a great experience. All the best.